I think you just need to.
I unmuted this one and it's fine. It's on. This audio is on. Yes. We're good. Yeah. Yeah. You got it started. Just testing out the slide sharing screen. I think we're good. Okay, go ahead. Yes, all right. Are you good? Yeah. Okay. Hello, everyone. I think we need to say hi. Can you all hear me? Yes. Okay. So welcome to the Pre-PA and Nursing Club meeting. It's our first one in person. So woohoo. All right. So we're just going to introduce ourselves really quick. Is that working? That's smart. Yes. All right. So I'm Caitlin. I am the president of the Pre-PA side of this club. I'm majoring in biology and I have the integrated physiology neurobiology track, and I am minoring in sports science. For my current job, I am a medical assistant. And just so you know, that's how you get patient care hours and everything, which I will talk about. I have a presentation coming up, I think our next meeting, where I just go into everything about being a PA. So don't worry, I will answer all of your questions. I have another certification in being a CNA, so I also know about that line of work as well. So feel free to ask me about anything. I have some shadowing experiences also. I have it in peds, family medicine, and trauma surgery and acute care. All right, so Cassidy is next.
Hi, I'm Cassidy. I'm the nursing president, and my major is human biology, minor is nutrition. My patient care experience right now is that I'm a CNA at Wake Med, but I was a CNA at the nursing home prior to that. So I've had a few months as a CNA, so if you have any questions about how to become a CNA, how to become one during COVID, I can help you with that because I became one during my winter break last year, and I didn't have clinical experiences, so that definitely changed things. If you have questions about that, just let me know. And then my future plan is to attend an ADSN program next fall. I've already started applying, so if you have questions about the application for that, how to get letter of recommendation, personal statements, that's
Hi guys, I'm Prachi. I'm the Pre-PA Club Vice President. My major is nutrition science and my minor is psychology. My PCE is mainly working with a couple different charities, including BAPS and also Red Cross. My shadowing experiences include emergency medicine, pediatric medicine, and geriatric medicine. And my future plans are to attend a dual master's program for public health and PA.
Hi, everyone. My name is Caroline. I am the secretary and treasurer of the club. My major is nutrition science. My minor is health. I'm a senior. And to obtain my patient care hours, I've been a scribe in
the emergency department at UNC Rex right down the road for about 2 years now. And I've been a cardiology technologist at the same hospital for about 8 months. So I submitted my applications for PA school in April, May, right when CASPA opened, and I've been admitted, so I am going to go to PA school next fall. I don't know where yet. I'm still waiting to hear back from schools, but I can answer everyone's questions about CASPA and the application process, interviews, all of that. So I'm excited to be a resource for our club.
All right, so now I'm just going to talk about the overall, what happens in our meetings. So we always have a guest speaker, or typically have a guest speaker. These can be admissions counselors, students, like going through the process currently, or practicing providers, which is who we have today. I am going to send out an email tomorrow, and it's going to have the Zoom recording to this meeting, as well as a link to a Google form. And because we would all like to incorporate some workshops this year, since we can be in person. So we're just going to ask you what kind of workshops you're interested in. And we're going to see if we can get those going this year. So that'll be very exciting. And at the end of every single meeting, we have a Q&A session, just so that you can ask the providers or any of us, any of your questions, okay? So we meet the first Tuesday of every month, or at least we try to, just depending on the holiday. And our meetings last about an hour from 7 to 8 p.m. But if you want to stay after with questions, we're more than happy to stay with you. And we meet both in this room, so thank you for finding it, or over Zoom. And all the meetings will be recorded and uploaded to YouTube. It usually takes a while for them to upload because it's such a big file, but I try to send it out the following day. All right, so if you miss a meeting, it's not a big deal at all. And then over here, I just have the meeting dates. And I'll probably send out this PowerPoint as well, although I think you guys already got all the email dates from my last email. But here they are again, if you would like. We're still figuring out a couple different meetings, depending on like what workshops you want and stuff like that, which is why some of the meetings are just labeled as PA meeting. It means we might have a guest speaker, we might just do a workshop, we're not sure yet. And then also, I made a Google Calendar with the meeting. So if you want to subscribe to that Google Calendar, all the meetings will automatically be in your Google Calendar. All right, so how to join. So there are a couple different ways. If you go onto the Get Involved page, then you search for our club name and select join, then you will be admitted into our email list. Additionally, if you just want to email me or any one of the officers directly, we can just put you right in. So whatever is easier for you. And during the email list or on Instagram, which I'll get to, I'll send out reminders, as well as post job opportunities and shadowing opportunities. So I've gotten a lot of questions about dues, and how that works is you pay us the $15. We actually send half of that money to the pre-health club. So you're essentially paying for both our dues and the pre-health club. That's just a requirement. I think the pre-med club does something different where they just have you pay the pre-health club directly. I don't know why it's different, but it is. So to join, all you have to do is get on the email list through either Get Involved or contacting one of us and pay your $15 in dues, and then you're good to go. And so the handle for Instagram is up there, and we actually had money left over last year, so we did some giveaways at the end of the year. So I think you might want to check out that.
We gave away an $100 Figs gift card, which if anyone knows, those are the best scrubs out there. And then we also gave away a stethoscope of the person who wants choice.
It was a Littman stethoscope too, so it was a
Yeah,
really nice
very good
one.
quality. So follow us on Instagram and stay tuned.
All right, so do you guys have any immediate questions just about the club? No. Okay, are there any in the chat at all? Okay. Okay. All right, then the next thing was that we were going to have a presenter come and talk to you about CareYaya. I don't know if any of you were at the pre-health meeting, but she did speak there. Unfortunately, she just emailed me and said that she's feeling a bit under the weather, so she wasn't able to come, but it is a job opportunity, and I do have her slide. So it's just a way for you guys to get direct patient care hours without having any certification. So you don't need to be a CNA or a CMA, which is a certified nursing assistant, certified medical assistant. And these hours you accumulate, and you need at least 1,000 hours to apply to PA school. You want more than that, but you need the minimum 1,000 hours. So with this program, It lets you work directly with the elderly. You don't need the certification. You can choose your own hourly rate and your own schedule, and they'll talk about your hourly rate in terms of pay. It's very easy to start. It's made for students who are still in college and everything. It's similar to an Uber where like you choose the people and they choose you, I believe. Not entirely sure, but that's what I've gathered from it. So,
Two things I'll just add to that is you do need a lot of patient care hours to apply to PA school, but some like ECU, for example, only requires 250. So 1,000 is like Duke requires 1,000. That's kind of like what you want to strive for. But some schools don't require any. Some are minimum like 250. So I would just research schools that you're interested in. But again, we'll talk about that in meetings to come. And then also in terms of job opportunities, Rex, where I work, has lots of opportunities for people who don't have any certifications to be a scribe. You don't need any. You just need some prereqs like anatomy and phys, biology, medical terminology. And then there's also jobs for COVID swabbing and watching patients that are on IVC paperwork. So I would look at UNC Rex online if you are interested in jobs. It's right down the road, 5 minutes, and they pay pretty well. So
And I
look into
don't-
that.
yeah, and I don't want this to overwhelm you either. If this is your first meeting, you're like, oh my God, I need this many hours and I have to start working right now. We'll get into it all at the next meeting when I present everything, but just want to give you a heads up. That's what you're in for if you were unsure about that.
Yeah, and another thing I'd like to add on is that if you guys all go to this website called EPAC, there's a bunch of clinical opportunities on there. So basically what you do is you hop on the website, you log in with your Unity ID, and if you type in like clinical assistant or medical assistant or anything that aligns with health professional terms, then you'll be able to find out what postings are available. And since CareYaya is more of an Uber concept where you work from a patient to patient basis, if you're looking for something more stable, I guess. So like if you only want to work on the weekends, or if you can only work a certain amount of hours during the week because you do attend classes, then I would definitely suggest go on there and see what providers are willing to work with you.
All right. Any other questions that you might have? No. Okay. Well, without further ado, who's going first?
We're going to turn it over to our providers. We have a nurse practitioner, and then a PA, and she's on Zoom. But we will turn it over to Amanda, our nurse.
So my name is Amanda. I did my BSN at UNC Chapel Hill, and I've been an ER nurse at Rex for about 4.5 years now, and I love it. I started as a CNA, so if anyone has any questions about that or where to get started, let me know. Give me some more guidance. Introduce
Where are
myself.
you in school right now?
That. Okay. So in addition to being a full-time nurse, I'm dual enrolled at both Duke and Campbell. So I'm doing a master's in public health at Campbell. I'm also a family nurse practitioner student at Duke. So if any of y'all have any questions about that application process, I can try to field those as well. There we go.
And then just
Sorry, I'm so bad at
give us a brief summary of your everyday job in the ER.
So that is really hard because I've been an ER nurse for 4.5 years, and I don't know that I've ever had 2 days that have been exactly the same, which is part of why I love the ER. You never know what you're going to get. So, I mean, today, for instance, I had patients all over the board, from cardiac patients to strokes to abdominal pain. And the cool part about being an ER nurse is you have to, be able to make a lot of decisions independently from the providers and let the providers know what you need from them. And you just learn a lot along the way because no two patients are ever the same down there. So.
One last question just for your intro is what got you into nursing?
Oh, that's kind of a hard story. So and unfortunately, it's not like a super like fluffy one, but I started at UNC Chapel Hill as a biology student. I thought I wanted to go to medical school, and I had pretty good grades, but I just wasn't feeling all of the labs and chemistry and all the things. So my advisor actually recommended going to nursing school that incorporates a lot of that science in a way that's very hands-on, and you get to work with people a lot more along the way instead of labs. So I really owe it all to that advisor. I mean, because of him, I ended up, being a nursing assistant, going to nursing school and practitioner school and all the things. And I've had a lot of help along the way. You got to find mentors.
If you want to come give your, please stay up here. We're going to have questions.
So hi, everybody. I'm glad you're here and excited for your future so I can retire. I'm Mary Ann Berger. I'm a nurse practitioner and a nurse. So I was thinking, gosh, when I started, my first job, I'll give you an example, my first day, I was in a nursing home as a nurse's aide, and somebody came up to me and she was really old, but in a nice dress with a bag in her hand, and asked me which way it was to the trolley. And I told her the way out the front door. And she walked out the front door at about 2 o'clock in the afternoon. They found her at the park at 11 o'clock at night up the hill, demented, and the police had to find her. And that's how my nursing career started. On a bad note with my mother, who was a nurse. But so I went to West Virginia University and got a bachelor's of science in nursing. And currently my brother's dean of the School of Pharmacy there. So if you want to go to West Virginia, just let me know. I did a master's of science. It was the first year they had the program in exercise physiology and cardiac rehab. My dad had a heart attack and I wanted to learn everything about that. And it was a really, really good situation. I wanted to keep learning about cardiology. And I went to Duke and did an externship as a senior in nursing school, and then continued at Duke and worked in the medical ICU. And then I went to the CCU. And then I was a heart and lung transplant coordinator back in the early days when we first started heart and lung transplants. And back in those days, we didn't have options that we do now. I mean, people are living so much longer and they don't need cardiac transplantation as much. We have assist devices that we put in their heart. We have new medications for heart failure that prolong life. So many things have happened since those days. We still do heart transplants. And actually we did a really young friend of ours, got a transplant last year, and she's doing very well. She was an athlete. And, iatrogenically got an enlarged heart. And later on, maybe before we end this, we can talk a little bit about COVID, and we can tell you some of the really bad things we've seen in the hospital this year with that are COVID related in the heart. But after the transplant, I went to anesthesia and worked, and then I went to a program called pulmonary hypertension and directed that. And back in the days, there was a craze of people that took diet drugs called fen-phen, and it caused your heart valve to go bad, and it caused high pressure in your lungs called pulmonary hypertension. And people won big lawsuits because the drug really was bad. It was taken off the market, but we unfortunately had a lot of really sick young ladies due to the medication. And then after that, I went into private practice in cardiology, and I worked at Rex and Wake and Main Wake. And currently I'm at North Carolina Heart and Vascular. And I'm a nurse practitioner, and we do all the admissions and consults in the hospital. We do the stress testing. We do the discharges. We do cath prep, and there's about 40 NPs and PAs, and we run the heart hospital while our docs are in the cath lab doing procedures. And they, at Rex is UNC Rex. They do interventions. They do cardiac caths. We do bypasses. We do peripheral vascular disease surgery on the legs, where we put stents in the legs, stents in the hearts. We do structural heart procedures where we put clips in the mitral valve when people are really old and they couldn't tolerate an open heart surgery. So it's a growing practice. It's on Blue Ridge Road. It's all lit up. It's a big, usually it's light blue, big heart hospital. And we have lots of opportunities for young people like you guys to get some experience and get your hours. And I can tell you right now, it is a go for people that want to go into medicine. It's booming. And, you know, I'll tell you right now, I talked to a nurse the other day, and don't think you're going to get this all the time, but we have about 70% traveling nurses right now, because nurses have finally, in all these years, taken a disposition and moved to where they are getting the best opportunities. And there was a traveling nurse making $6,000 a week for a 3-week assignment. Her hotel was paid for, and she's getting $500 a month for food. They're desperate for nurses. We're hiring travelers. We're doing anything we can to get stability. But right now, this is a growing time for nursing, and it's a time to step up, and it's a time to take power. And we have actually a really good nurse in the legislature. She's in the House of Representatives. Actually, her name's Gail Adcock, and she's one of the first nurse practitioners. She started SAS, the nurse practitioner program at SAS. And if anybody is, into government, she's a big person to reach out to and helps give you guidance. I just did a big market analysis for what NPs and PAs should make. And she helped give me some, just tell me some research data and give me some links to review and look at. But it is a growing field right now and it's booming, and you are definitely in the right field. And the one important thing I tell you is you got to get up and absolutely love what you do every day. And you got to be cut out for this, but patients are dependent on us. They're in need of us. And, in COVID, we were the people that were on the front lines. We saw different sides of a lot of providers, and some people didn't want involved, didn't want to be in it. And then there were nurses that said, hey, I've been through HIV. I've been through Ebola virus. I can take care of this. I can do this. And you know what? I'll tell you, the first few times we just went in and said, we can handle this. And you put on, actually NC State made these, they're called Pappers, and it's like a football helmet. And it's got a little cartridge you put in your pocket. It's a battery and it blows, and you got a plastic shield over it. It blows air in your face. And you're enclosed and you were protected. And we went in those rooms and saw those patients. And now, unfortunately, we're seeing the unvaccinated patients. And I'll just tell you quick, and then I'll show. It's affecting your heart. It's caused, COVID can cause you to have an enlarged heart. It can cause you to have a heart attack. It can cause you to have a blood clot called a pulmonary embolism. It's mainly the unvaccinated people that we're seeing right now in our hospitals are blowing up. And, we'll see what happens with the football games and everything, but hopefully, these young people aren't going to be in there and dying. But I'll give you an example. Last week, I was in the ER and this lady came in and she was profusely sweating. I mean, water was dripping off her, like it looked like a swimming pool just running off her. I've never seen anything like it I've been a nurse practitioner for 26 years now. And she was very cold in the periphery. So I knew her heart wasn't getting good blood flow. And we did a stat ultrasound of the heart, like they do on a baby. We looked at her heart and her heart muscle was just not even contracting. And we took her immediately to the cath lab and put something called an impella. It's a motor in her heart to help her perfuse. And unfortunately, she passed away in 24 hours. But this is what we're seeing. And this lady had no comorbidities. In the beginning of COVID, it was, okay, these people are Spanish. These people, are just different ethnicities, and they were congregating together. Now we're seeing all different, young, old, no comorbidities. So just be safe. And that's all. I talked enough.
We'll turn it over to Stacy now. All right. You're up on the board, Stacy. Oh, 1 second. We are working with sound here. Okay, we can hear you now. Oh, wait.
Oh, no, we can't.
Sorry, 1 second. Go ahead and test it. No. Oh, you're muted. Stacy, you're muted.
Thanks, whoever popped that up.
You're good now. We can hear you.
Okay, sounds good. Well, thank you guys for having me. I appreciate it. Yes, I'm a PA. I've been a PA for 15 years now. In undergrad, I knew I wanted to go into medicine. At that point, NPs were pretty popular. There wasn't a lot of PAs. I didn't even know what one was in undergrad. I originally started out as a biology major, and nothing against all of you guys in biology, but I got really tired of learning about every other animal, fish, bird, everything in the world except for humans. So I switched to exercise science, exercise physiology with a minor in nutrition and health promotions. Near the end of school, I still hadn't decided what I wanted to do in medicine. And I actually had a doc that I was going to say, hey, Stacy, you'd be a really great PA. And I remember being like, yeah, okay, I'll consider it. And driving back to school going, I don't even know what in the world this person is talking about. I don't even know what this position is. So I did some research. I actually was in an interesting position where my mother was a nurse practitioner, a neonatal nurse practitioner. So you would think she would automatically be like, hey, go the nurse practitioner route. The problem was at that time, as Marianne can probably attest to, you couldn't just go to NP school. You had to become a nurse, and you had to be a nurse for like 5 or 10 years, something like that, before you were even allowed to go to NP school. So looking at all my options, I also had no idea what in medicine I wanted to do. And I'm sure these guys will get into it in some of their lectures and stuff like that. But nurse practitioners, you have to kind of pick different types or areas. I don't know all, but I know that like my mother's neonatal, so she couldn't take care of anything else. She decided she might want to take care of kids, so she had to go back to school for her pediatrics. You know, there's some that are just adults, some that are family, some that are critical. I didn't know what I wanted to go into. So it worked out for me to go into PA school, because then now I can take care of anything from birth to death. So I'm not limited on my areas. So I do think it's important for you guys to look at what you want to go into. Yeah, I can do birth till death, but I am not trained as extensively as people who maybe nurse practitioners that are trained only in critical care. So I have to do a little bit of extra studying, because I didn't spend as much time in school where they spent the majority of theirs just in critical care, if that makes sense. So in school, graduated. I had gone to Eastern Virginia Medical School. So up in Norfolk, Virginia is where I went to PA school. I had graduated and came down and started working in cardiothoracic surgery at Duke. And I was there for about 6 years. I worked primarily in heart transplant, lung transplant, LVADs were my kind of niche. Loved it. Great place, great everything. I just had a little bit longer of a commute that I liked, and I was working a lot of hours, which is typical in the surgical arena. So after some time, I decided that I needed to kind of readjust life. Very plus to going to NP school or PA schools, you can move into a different specialty. We're not like physicians where you'd have to redo a residency. So I switched over and went to cardiology. I now work with Marianne over at North Carolina Heart and Vascular, and have been there since 2013, and love it. So it has been a very good move for me. I like the flexibility that the positions give you. I love the autonomy that you can be given depending on what position you choose. But I also love the ability to work with physicians and other advanced practice providers to collaborate on patients. So what else can I tell you guys?
I was going to ask if you would touch on your administrative role.
Oh, yes. I did a little bit of administration at Duke, heading up a small group there. At North Carolina Vascular, when I started, Marianne was already there, but I want to say I was like the 5th or 6th APP to join. And now just for the inpatient cardiology group, there's now close to, if you include some of the casuals, there's close to 50 of us. So there's a lot of us to run that cardiology aspect of the hospital. So I am also a team lead. So I spend a little over 50% of my time still practicing patient care, bedside care, everything else like that. Just under 50%, I have also chosen to do administrative. So more managerial work, working on schedules, working on hiring new people, working on keeping people as in line and forward thinking as possible. Sometimes I feel like I'm more of a therapist than anything else, but I really enjoy it. I don't ever plan on leaving bedside, but I love the opportunity of doing both. And I'm currently enrolled in getting my master's in health administration to hopefully help out on that aspect of it.
Great, thank you. We can turn it over to questions now. If anyone has questions to ask about anything from what they do on a day-to-day basis to salary, application processes, anything. Yeah, go ahead.
One is specifically for Amanda, since you attended Chapel Hill. Yeah, I'm applying to nursing school. I just wanted to ask a little bit more about, following the whole application process and maybe like what you specifically did. So I'm going to tell you exactly what not to do, if that's okay.
we'll go the opposite direction. So remember that meeting with the counselor I told you about? And I still remember his face clear as day. He really pushed me to nursing school. I failed to tell you originally that he pushed me to go to nursing school probably about 2 days before the deadline. So surprise. So I don't recommend doing that. I recommend applying early, write your essays. If you're doing patient care hours as a nursing assistant or a medical assistant or something, and I think this is probably relevant to whether you want to go to NP school or PA school. It doesn't hurt you to have like a little notebook where if you have a patient experience that's really special, to write it down so that you remember. Because when you apply to nursing school, or when I applied to NP school last year, and I'm sure PA school has questions about it, they ask you, tell us about a time you went above and beyond. And it was one of UNC's questions. And Duke asked about it too when I applied. And sometimes, we do a lot of great things for people every single day, but you don't always remember the specifics. So if I could go back and do it over again, that would also be something that would help, across multiple applications. And my other piece of advice is have somebody that you trust to reread those essays for you. Because I found, at least in my instance, I know what I'm trying to say in my head, and to me it makes perfect sense because I pour over that essay over and over and over again, to where sometimes the errors don't stand out to you anymore because you've looked at it so many times. So find someone that you trust to read over it, maybe someone with experience that can also help tailor those essays to the school you're applying to.
We have a Zoom question. Someone asks, does patient interaction differ between nurses and physician assistants?
Oh, that's interesting.
Maybe Stacy, you want to touch on that? Between maybe nurse practitioners and physician assistants?
I was gonna say, so between nurse practitioners and physician assistants, no. I will tell you that in some states, physician assistants or nurse practitioners are more common in certain fields. So I'll tell you, like in North Carolina, if you want to go into neonatology, you want to deal with the preemie babies, you should probably go the nurse practitioner route because it is incredibly rare for a PA to get a job in that. Where out west, it's much more common. It's more common in North Carolina for PAs to work and get positions in the emergency department. It's not quite as common to find NPs there. You still can, just be aware if you're looking at that. But when it comes to the actual position, there for a nurse practitioner, PA, there is not a difference. Even for job postings, most of the time you will always see it posted as a nurse practitioner / PA. So in the day-to-day realm, that is different. Now let them talk about the difference between a nurse and an APP. So that umbrella term of nurse practitioner and PA, that has some definitely some big differences when it comes to patient interaction.
Yeah, and so keep in mind my viewpoint. I have always been an emergency nurse, so my experience is kind of limited to emergency nursing. I think compared to some other nursing specialties at the bedside, emergency nurses have a lot of autonomy because admittedly, we spend a lot more time with the patients than like our doctors do or our APPs do. So the nurse cannot write prescriptions per se, but they have to be able to monitor the patient and kind of assess when things are going downhill or changing, to communicate that to the APPs. I would say the thing that's kind of special about emergency nurses with ordering per se is some hospitals, and this will differ based on where you work, I can institute protocol orders that include medications, but those are protocol sets written by physicians and still need an APP signature on them. So I would say that's the biggest difference.
One of the most important things is we work as a team, and it takes everybody. And as an APP, you have to be the person that correlates that team and puts everybody together, whether it's the physical therapist or the occupational therapist or the nutritionist or the nurse. The nurse is at the bedside. The nurse knows everything, and you count on that nurse so much. We also deal a lot with pharmacy and
Respiratory therapy.
And respiratory therapy right now. And we order the studies, and we don't have any limitations on our no statute of limitations on what we can order in North Carolina. I think states like maybe Georgia just got the ability to order radiographic studies like CAT scans. But we work as a team together, and it's so important. But as a mid-level provider and a nurse practitioner or a PA, you're putting the whole picture together. And your job is to make it easier for that physician. So at least in the hospital where we work, we coordinate the whole plan of care for the patient. We order the appropriate studies, we review the labs, and we treat the patient. And then, our docs basically see the patient and we go over the care with them. Stacy was saying something.
Good.
Stacy, did you hear that question?
Oh, I did not. Sorry. What was it?
Somebody asked, do you want to repeat your question?
How do you maintain a work-life balance and how do you deal with taking home difficult?
Caroline, can you repeat it? I can't hear.
Yeah, maintaining work-life balance and dealing with difficult situations.
Oh, so
Tough one.
maintaining work-life balance, hugely important. I'm not really good at it right now. But it's definitely something that you have to stay on top of. But I would say in the same respect that you guys are trying to stay on top of having a school and life balance, a school and a social balance. You're always going to be having to search for that. And it can be difficult. I will say, depending on what specialty and what area you go into can make a big difference. Going into surgery is going to take a lot more hours a week than it is if you're going to be in a non-surgical. For some people, working somewhere in an office from normal office hours Monday through Friday is going to give you a much better work-life balance than in the hospital, where you could be, you're typically working 12-hour shifts. You could be nights, it could be weekends, it could be holidays. So look at the position. It is definitely obtainable. And difficult situations, they come up often. I have gone to and would recommend a lot of courses on how to deal with it, how to look at stuff objectively. I use a lot of kind of tree diagrams to help work through to make sure I'm being objective and fair in every situation. And knowing who your mentors are in the field. I don't care how long you've been in it. You should have people that within that field that are mentors that you can go to ask questions, to run things past, stuff like that, that are not even in your immediate work area. So always find and keep those.
Yeah, go ahead.
What was it like, such the process for switching specialties as a PA? Like you said, for being in for 6 years and switching, what was that like?
Did you hear her, Stacy?
I did not.
So she's asking you specifically, since you switched positions, how was that transition after being in one for 6 years and then transitioning?
I'm really happy I did it. It was hard. I'm not going to lie to you. I knew my CT surgery down pat, eyes closed, could go in and do it. But I didn't realize how much I did not know in cardiology, or how much I had lost in cardiology. I remember one of my first days, I went with one of the docs rounding on my kind of quote orientation. And I listened to a heart and I was like, oh my word, look at that murmur. Look, listen to that murmur. It's crazy. And I remember the doc looking at me like, are you crazy? And I'm like, oh, in surgery, they're always fixed. I never hear the problem. I just know what it's like afterwards. So I had to sit and take my first 6 months in cardiology and get back in the books, get back into learning, get back to my CMEs and just be a student again, but it's totally worth it. If I ever got tired of cardiology, I wouldn't hesitate at all to find something else I was interested in too and jump and learn.
Any questions from the room right now? All right,
Can I bring up one thing?
Yeah.
I think it's important for you guys to understand the board issues. Well, so when you're a nurse, you take the NCLEX. When you get done nurse practitioner school, depending on your specialty, like when I went through, there was just adults, gerontology, and pediatrics. Now there's so many different fields, Amanda's getting a subspecialty in
Yeah.
cardiology.
So, and I mean, to earn the subspecialty, and it's also hard too, because for nurse practitioners, the rules change a little bit by state. So you would really have to look in where you're trying to work and really hone in on what that state's rules are.
But as a nurse, you can get a compact license and you can get you take the NCLEX.
Yep.
And you can get licensed for like, I don't know how many,
I think
15,
it's up
12,
to, no, it's up to like 32 now.
32 states. So you can go, you have reciprocity to go state to state and practice. As a nurse practitioner, there's two credentialing bodies, AANP and ANCC. And so you pick a credentialing body and you take the board. This is the good thing about a nurse practitioner. I'm still in my profession now. One time and you're done. You pass that board and you do not have to take it again, except for you have to keep your CME. But the disadvantage is I'm only adults, or my daughter's only acute care, whereas Stacy can take care of anybody. But I'll let her talk about the PA board.
Yeah, the PA board. So I still have to keep up with my CME. It's divided out differently than how the NPs are, but it averages out to be the same per year. So don't get hung up over that. I consider it positive, or I'm choosing to. PAs, you do have to retake your national boards. There's a little variance to it now. When I first got out of school, I had to resit for my national boards every 6 years. I think I've taken it 4 times already. It's just as nerve-wracking the 4th time as what it is the first. I like it because it forces me to sit down and relearn everything. Granted, I don't like learning like my OBGYN or my peds when I never see it, but it's good. They have recently gone from a 6-year to a 10-year cycle. And they just piloted a program a couple of years ago that so far is working. So we'll see how far it goes. I've seen a few of these programs pop up before and then disappear, but there's a program that at that 10-year mark, instead of sitting down and taking I forget how many questions are, like 600 or something. You can now, over the course of a year, you answer like 25 questions every 3 months for a few years or something like that. I don't know, but it seems to be much better. So that is a difference. I do have to take, in some form or fashion, my national boards every 10 years. That covers everything. So it is a downside.
And the other thing I was going to tell you about CME, so we are required by the state as nurses, as nurse practitioners, as PAs to do so many CME hours. Your employer will pay. Like our employer pays us $2,500 a year. And if it wasn't COVID, we could go somewhere and do it, a little vacation and take a CME class. So many of your CMEs have to be DEA, like the Drug Enforcement Agency. You have to have, as you prescribe narcotics, you have to have CME that is relative to that too. Go ahead. She was going to.
Somebody asked in the Zoom for you to talk about accelerated nursing.
Oh, okay.
programs.
I will tell you what I know. So I did Carolina's traditional BSN. So you do 2 years of prereqs more or less, and then 2 years of nursing school. I believe Carolina's ABSN is roughly 18 months. So it goes through all of the same classes, same information, but it does it at a much faster pace. So I would just recommend to anyone looking for that route to just be, mentally prepared that nursing school is challenging even when you're doing it slow. So if you're doing it a little bit faster, just be really prepared to study and probably work on that work-life balance prior to starting.
Any questions in the room? Yeah.
You touched on how there's so many different positions within the healthcare system. How is that expanding? How do you guys make that decision? What's the best way to go about it?
I guess I can kind of talk about this because I knew I wanted to go into medicine a few years ago. I had a family experience that drew me to medicine, and I was at state, and I was kind of in the same position you're asking, like, well, I want to go into medicine, nursing, PA, MD. I kind of eliminated nursing just because state didn't have a program, and I knew I didn't want to go to a nursing program after undergraduate. And that kind of eliminated nurse practitioner as well. And then I focused on PA and MD, and I guess I eliminated MD based on like how many years do you want to be in school? Do you want to start seeing patients 10 years after you start school, or do you want to see patients 2 years later? And then things like Stacy talked about, like she can lateral mobility, she can see a cardiac patient tomorrow and then switch to OB the next week. Whereas a nurse practitioner can't do that. And a doctor can't either. So, and then I guess you can think about salary as well if you want to think about the different amounts you're going to be making in each position. Those are things I thought
I
about.
do want to say one thing, because you're a guy doesn't mean you can't go into nursing. You could kill it in nursing. Think about it.
We need them. And, you know, I'm biased obviously because I'm a nurse right now, but, you know, compared to other bachelor's degrees, a nurse with a bachelor's degree, the income is fairly decent compared to some other majors. You'd, you know, how much money you make, it's not everything, but it is important.
And you
sometimes.
make shift differential on top
Yes,
of your base
so-
salary.
Even if you're not wanting to do the fancy traveling, like Marianne was talking about earlier, right now is a hot time to be a nurse. There's a lot of extra incentives. Most hospitals pay nurses differently based on what day of the week it is that they're working or what time of day it is they're working. And I mean, I'm biased, but you know, when my 12 hours is over, I'm done. I don't have to do charts. I don't have to like, sign orders that the nurses put in. I don't have to do anything. It's just
My,
time to go.
one of my daughters in Atlanta is a nurse in NP school, and we were sitting in a game and she was getting offers for a $100 gift card, an extra 20 a shift. The next day it was an extra 30 a shift. I mean, there's so many opportunities. So
yeah, it's not uncommon for, at least like in the ER, there's like shifts where nurses are getting offered double time, you know, an extra $25, $30 an hour on top of what they already make. So.
Yeah.
I have a follow-up question. Sorry, do you think that's only subjective to like the COVID time?
So I mean, I've been an ER nurse 4.5 years, and while the incentive hasn't always been that great, there has always been the opportunity for overtime / some kind of incentive shift.
I think it depends on where you live, because before COVID, she was offered those kind of incentives.
Mhm.
But with COVID, it just blew up and got a lot worse, a lot better, I guess.
Yeah, and I think, and it's like where you live and what specialty you are, because, you know, to create an emergency nurse takes a little bit more time than it does to create a nurse that does like med surgery kind of stuff, because like we talked about earlier, emergency nurses do a little bit more stuff than some of the other disciplines do.
Right, and one thing I'd like to add on is though, research goes a long way. I would definitely recommend shadow, because I've definitely had friends that have said, oh, I want to go to dental school for like 8 years of their life, but then as soon as they go and shadow a dentist, they're like, oh crap, I don't want to do this anymore, and they completely change their
And she's completely
mind.
right.
So
But-
any opportunity that you get, reach out to a provider if you know anybody, and if not necessarily shadowing, but like researching also goes a long way. So doing both hand in hand right now is the perfect time, whether you're reaching out through email or even virtual shadowing, anything goes a long way. So definitely shadow and figure out what you want to do and focus in on.
Stacy, a question for you in the chat.
Yes.
Did you
Yeah.
ever consider MD school? And if you did, what are the deciding factors?
Yes, I actually had planned on going to MD school probably for most of my undergrad. I would say the big deterrence for me, one was having to pick your specialty. And I really, truly, like I knew I wanted medicine. I had no idea where in medicine. So the idea of needing to pick a specialty, even within a few years, I did not like that. I felt like that would tie me down. So I really like the idea of PA school, or even most of the NP stuff that I can move around. I also was happy, or I am happy, and like the idea that the buck doesn't have to stop with me. Am I a provider? Yes. Can I order diagnostics? Yes. Can I make a diagnosis? Yes. Can I do treatments? Yes. But if I'm ever in a position where I'm questioning anything, there is a physician tied to me that I can go to and ask for help, and ask for that final word. So one, I wanted that. I didn't want to have the weight of not having somebody further up the chain to go to. The second big compelling thing was work-life balance. You don't see a lot of part-time MDs. You don't see a lot of, that type of stuff. Every MD I knew and everything else, their life was work, and their family and everything else seemed to come second. And I wasn't willing to have that. So I feel like I get a much better work-life balance by being a PA.
Okay, thank you. And then also a few patient care hours questions for you. Do you recommend taking a year or two after undergrad to get patient care hours, or is it better to get them in school?
I don't think it matters. I would say do whatever works best for you and your life and what you're doing. Don't feel like you have to rush through. And as soon as you graduate, you have to be going on to grad school. You know, if undergrad is enough and you want to do your, you know, your work, life bound, school, life bound and stuff like that, do that. And then when you finish, then go get all of your patient care hours. And I wouldn't wait longer than a couple years, just because you'll get so far out of that thought process of school and studying and this and that. And the chances are the longer you give it, the more you won't go back. But I've sat on some of the boards, you know, picking people to go to PA school, and nobody looked any different from somebody who's coming right out of undergrad and had all their hours versus somebody who waited a year or two. We had a lot of people that became EMS and would work as EMS on with ambulances and stuff like that for a year or two to get hours and then go. So I don't think it matters.
And then to follow up on that, somebody asked, do you recommend EMT or inpatient to get experience?
Either. I will say that some of our EMTs, and we actually have a lot of people that went on and became paramedics during that time and then went to PA school, and they're good. I think because they interact with so much of the public, they see everybody from A to Z. They're used to interacting with people. They're used to seeing a bunch of different things. I think both are good.
I wanted to ask Stacy, what's the average age of a initial PA when they get out? Do you know?
I don't know. I would say young. I was practicing by the time I think, well, now giving away ages, but I want to say I was practicing by the time I was like 24. And I think I was pretty average in my class at that time for PA school. But I would also, there's a lot of PAs that I know that it's their second career. They didn't even go back until their mid-30s, late 30s.
Does anyone
So I
have any
don't know.
more questions? Yeah.
I feel like my whole like schedule and like timing for everything is off because I wasn't really considering nursing until this summer. And so now I'm a senior and I'm looking at all these accelerated nursing programs and their deadlines started fast fitting for next year. And so I was planning on getting my CNA over winter break and then working. And so like, is that time okay? Because I know in a lot of the applications, you have to have your required classes within 5 years of the application. And I'm just kind of worried about my timing being talked about everything.
So I would watch your academic credits. Are you okay if I answer this?
Yeah, please
Okay.
do.
So I would watch your academic credits and then take advantage of that time you're not in school to get some hands-on patient experience. So before I went to nursing school and while I was in it, I worked full-time, and I went from working in a long-term care unit that was primarily geriatrics. I worked in an adult bone marrow transplant unit at UNC for a while as a nursing assistant, which was pretty cool. And then I actually worked in the ER where I work now as a tech. And I loved different things about all of those jobs, but kind of like what Stacey was talking to, it made, by the time I was a nurse, I was comfortable talking to people and actually putting my hands on people to do things, which will be an invaluable asset to you in nursing school. But almost more importantly, it'll make sure that that's really what you want before you do it. Because like she mentioned, I have people that did the whole BSN with me, and a year later, they weren't nurses anymore. And it's kind of, you have to know that that's what you want and know that you love doing it. Because, your patients can tell when they have a nurse or a provider or a doctor, or whoever, that isn't really in it. So
what would be your like recommended path with it? Because I know there's like CNA, MA, and tech, and I would really like something that's more hands-on, like with the nurses. And so I just don't know which one aligns with that the most.
So I was a CNA, and then I was technically a CNA too when I was in ER tech, although that's not required. You can be an ER tech as a CNA one. So I think part of it is the credentialing, and I've never been a CMA, so maybe one of your colleagues that's been one can answer that part better. But I think it also depends on the work environment where you work, because at least in the emergency room, a lot of the nurses that recognize that their techs were in school will be like, hey, I have something really cool. Do you want to come see? Likewise, a lot of like the APPs that realize like I'm in school will be like, I have something really cool. Do you want to come see? So I think as long as you are in the environment and submersing yourself and learning, like you're not going to have you know, there's no such thing as bad experience.
Any other questions? You wanna do
Okay, so I have a question. We'll give you a couple quiz questions and you get a prize if you get their answer. What, you could think of one, Stacy. I'll let you grab one. What is a STEMI? Okay, come on, passing that one. Okay,
But if we give them some hints.
okay. Let's see. All right, how about, anybody know what cardiac output is? Okay.
Come on, y'all, it's physiology. You can do it. Don't be afraid.
All right, does anybody have a family?
Oh, wait,
member-
you have a hand
Oh,
up. in the
whoa,
back.
where?
Yeah, see?
Go ahead.
That's how much blood your heart pumps, that's the output for how much blood your heart pumps out.
Awesome. Come down here and get your prize. Cardiac output is how, it's your heart rate times the volume. And it's
you want to tell them what the
cardiac
prize
output is 4 to 6 liters of blood go through your heart in a minute. And her prize is a heart stent on a necklace.
Oh.
So I'm just gonna tell you a little story. I'm not trying to sell this.
This is it.
My dad had a heart attack and I always, and a stent saves your life. You go into the cath lab and we put one of these, it looks exactly like that, a little device in the artery and it opens it up and cannulates the artery and keeps the artery open. Then you need antiplatelet medicine to keep it from clogging back up. And we came to NC State, Dr. Walker and Dr. House and myself came to NC State and tried to go to that Hunt library and make these stents at 3D imaging, and we couldn't do it. And they were turning out this big, and it was a big disaster. And then we tried to hire students to do it, and the design program, they couldn't do 3D imaging in jewelry. So it took a long time, but we came up with these heart stents, and we use them as teaching tools. We go up to the patient and say, hey, we're gonna put one of these in your heart and save your life when you're having a STEMI, which is acute heart attack. And so, Stacy, ask him a question.
I didn't even think of any questions.
You don't have a question?
I did not even prepare for
Anybody
questions.
have a family member with a stent? Okay, right there, come on, here you go. All right, take one more. Got one more?
I don't know, I'm kind of feeling like my question might be a little too.
Go ahead.
Okay, so, which common street drug is related to heart attacks even in young people? People like your
Good
age,
one.
one of them one street drug is more likely than the others to cause a heart attack. The youngest heart attack I've ever seen was 26. He was my age when I took him to the cath lab. Oh, okay, more hints. You snort it. There we go. I don't know if I should be like happy by that or a little afraid. Okay, here, you pick one.
No.
White hat in the back.
Oh, sorry. You got it, girl. Come on and get it. One snort of cocaine and you can have a huge vasospasm and a heart attack.
Don't do it, friends. You're gonna have to come see me at work.
If nobody has any more questions, I think that's it for our
There you
meeting.
go.
Thank you to all of
Thank
our
you so much for
presenters. We
coming.
appreciate you guys all coming.
Thank you.
And if you guys have questions and want to come talk to us, you're more than welcome to.
Also, there's snacks down here. Please come get them. Everybody.
And then I can send those.
Which is very hard. Right. But if like I wanted to be like a nurse, how would can I even do that at State?
So there's no actual nursing program here at state, but there's a bunch within North Carolina. So what we do is that we have nurses come out to our like club specifically and present like from admissions and like different professors. So we get to learn more about the nursing programs through that. Because state doesn't have an actual PA program or a nursing program or an MD for that matter. But yeah, so that's how we get involved with like other schools. And if you have any specific questions, you can definitely ask them too. Because I actually studied at Carolina and one of them studied at Duke.
Because like I know that nursing is like, it's a bachelor's in nursing, so you start it as soon as like, you like start undergraduate.
Yeah. So a bachelor's in nursing, technically you can, where's Cassie?
Exactly. And well, even like with virtual classes, like I work during the day.
Do you guys want to
And then doing schoolwork whenever I'm not working. And then
I think she's better than me.
So
Since she's-
I wasn't really.
Absolutely, any opportunity to make sure that y'all understand like what badass as nurses are. I didn't want to say that in front of the whole group.
I love nursing.
Yeah. So nurses are, I like to think of us as the providers like right hand a lot of the time. So you have